So your Medicare health plan doesn't always pay for your prescriptions when you're in the hospital. If you were ever admitted to the hospital and you were thinking everything was going to be paid in full, maybe just a small copay, and all of a sudden you get this bill that's, $200, $300, $400, it says it's for prescriptions, chances are you were not actually admitted to the hospital. Because if you were admitted to the hospital, then yes, your prescriptions would be covered under your medical plan, along with like the doctors, labs, surgeons, x-rays, medical equipment, all that. But if you were actually on observation, then the prescriptions are not covered under your medical bill. Now, you might have felt like you were inpatient, it smelled like it, walked like it, talked like it, and you might have been there 2 or 3 days. But if the hospital sends your claim to the insurance company and it codes it as observation, then the prescription portion of it is not covered under medical. It's actually going to be covered under Part D. So the hospital will carve out your prescriptions and they will send you a bill for it. Now, what you need to do is you need to take that bill, you need to request an itemized bill that will include like all the NDC numbers, which are the coding numbers for prescriptions. You need to get that bill, you need to pay it, then you need to send that bill along with your proof of payment on a claim form to your Part D insurance company, and then they will reimburse you. And people get surprised. They don't always get back from the insurance company what they think they're going to get, because it's really wonky the way the hospital bills for prescriptions when you're on observation. It's a lot more money than if you were just to go to the pharmacy and pick up a 30-day supply. So it's always a little bit surprising what people have to pay for those prescriptions when they're in the hospital. Now, if you can always call the insurance company to verify that this bill was submitted as observation and not actually inpatient. And then if you don't agree with it, you can call the hospital and you can appeal it. But most often when people do that, the hospital says, no, we coded it correctly and you are responsible for the cost of your prescription. So just so you know, inpatient versus observation, completely different deal.